CPR is like cardiopulmonary resuscitation, right? So CPR is a part of an basic life support as well as ACLS, advanced cardiac life support, ACLS, BLS. It includes a high quality of CPR. So CPR is a thing which I feel that each is not only for the nursing staff or the paramedic staff or for the doctors. It's not like that. It's for, I feel so, like people which, every individual, everyone should have the knowledge of what is CPR. Whenever we see a patient like having unresponsive, what we do? Generally everyone escapes, but we should not escape, isn't it? We should go down, we should go close to the patient. And we should check for the pulse, we should check for the breathing. If the patient is not having pulse and patient is not breathing, then we should always perform high quality of CPR, right? So the scenario should be whenever you see a patient, everyone should have for the CPR, everyone should have the BLS provider card or BLS instructor card with you. As a basic life support card, then only you are eligible to give the high quality of CPR. Happens in in the car parking area, in the mall, in a shopping mall, in the school, anything like that. What happens immediately? One should go near to the patient. They should take the patient to the safer zone. Why? Because suppose when the patient falls sick, he or she should be surrounded by 10 or 15 people. How will you give the CPR? It's not possible, isn't it? So what happened? You have to take the patient to the safer zone. We assume that the scene is safe. Why? Not for the patient, as well as scene is safe should be for you and the patient both. And of course, at the same time, you cannot perform the full CPR and the full cardiac arrest scenario alone. You have to call for the help also. So what happened? We should take the patient to the safe place. We should confirm the patient is lying on a flat surface, not on the curved or not like that. There's no slippery. If the patient is sweaty, then what will happen? We should take a wrap of cloth or the gauze piece to wrap the chest, rub the chest so that it can be easy for you to give the CPR. Right? When you are giving the CPR, it should be effective enough. That's our aim. Should be like that. When you are giving the CPR should be effective enough. But what is our aim of giving CPR? We give the CPR so that the patient should attain ROAC. What was that? The return of spontaneous circulation. We are pumping the heart, isn't it? When you're pumping the heart, the blood flows to the brain as well as the vital organs of the body, and the resuscitation start. Right? That is a CPR, cardiopulmonary resuscitation. So you should take the patient to the flat surface. What happened next? We'll ask for the patient. We'll check for the patient's responsiveness. Very important. Not like that. We should always shrug the shoulder of the patient like this. That is very important. We shrug the shoulder of the patient to have the patient responsiveness. If the patient is not responding, what will happen? What we'll do? We'll ask for the patient. Anyone cannot perform this task alone. But to ask for help. We should call for the help. At the same time, what will happen? We should check for the patient's pulse and breathing simultaneously. Where we'll check for the pulse, everyone can see it's our trachea, right? Just 2 centimeters away from it, 6 centimeters away from it, like after feeling the groove. There you can feel the pulse. What we call it is a carotid pulse, right? And carotid pulse at the same time, what will go to the patient's head end, and head end we should see the patient is having chest rise or not. Why chest rise? This chest rise because we can assume the patient is breathing or not. If there is no pulse and there is no breathing, immediately we'll start high quality CPR. How will we start the CPR? We always should crisscross the hands like this, right? And always with this pump, we should put the heel of the pump. We should use this for the CPR. This thing, not like this. The heel of the pump should be very effective. We'll start with this 1, 2, 3, 4, 5, 6, 7, and always remember when you're giving the CPR, your pelvis will bend, but your shoulder should be straight like this. It should not bend like this. It should be straight, right? You have to give 5 cycles of 5 cycle. 5 each cycle is a 30:2. What was the 30:2 meaning? 30:2 means 30 CPR is to 2 breaths, right? You have to give 30 CPR like this with your palm of the heel of the pump like this. You will give 30 and then you will give 2 breaths. If you don't have the like breathing mask, you can give it the mouth to mouth breathing also. That will be also effective for the patients, right? Remember, we have to give 5 cycles of CPR. That is, we call it CPR for 2 minutes. Like within 2 minutes, you have to give the 5 cycles of CPR. After giving the CPR, what we have to do, we have to again check for the patient's pulse. Where we checked previously whether the patient is having pulse or not, we will check for the patient pulse. No pulse, no breathing, will continue the CPR. Like that, you have to give the CPR like this. Okay. Along with that, by the time your help will arrive, what will happen? We have to take the patient. It's not possible for anyone to give the CPR along the way in the parking area or in the lift or in the school. Not possible, right? As soon as the help will arrive, 2 persons can give the alternate. They can give the CPR, and finally they can take the patient or they can shift the patient to the hospital for the further management. We can give. We should waste minimum 5 seconds, but not more than 10 seconds of in cardiac arrest. Not like you have to wait for 2 minutes. Okay, fine, patient is not like that, is not respond. No, we have a time. It's called window period. Within a very short time, we have to identify the patient is in cardiac arrest, and immediately we have to start the CPR. What was the time? Minimum 5 seconds, but not more than 10 seconds. That is very important, right? Okay. What was the next thing? When you're giving this first, then you have to give the since about the depth. The depth should be about the 5 centimeter for the adult as well as for the children, and for the infants it is 4 centimeter. Okay. Within short time, you have to give the minimum. We have to give the minimal time. We have to give the maximum compressions. Like so, minimal interruptions in compressions. You should not like 1, 2, not like that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Like that, you have to give 30. So, minimal interruptions in compressions. Number 3. Number 4, complete chest recoil. After giving 1 CPR, you should have the minimal time also for the chest recoil also. That is also necessary. So, complete chest recoil is very important. And do not hyperventilate. Why? What is the meaning of that? Especially when you're giving the 2 breaths, with maximum. We have to give easy and slow. It should be effective breaths. Why? So that effective breaths will help the patient for the ventilation as well as for the chest rise. When the patient is we'll go to the patient head end and give the chest rise, you can feel, okay, the patient is getting adequate effective breaths and adequate ventilation also at the same time, right? We have to keep these 3, 4, 5 points always in the mind. Okay. Number 1, you have to start the CPR within minimum 5 seconds or more, or not more than 10 seconds of a cardiac arrest. Number 1. Number 2, push hard and push fast. How much hard? Hard is about 100 to 120 per minute at fast rate. And how much hard? Hard in depth. Depth of 5 centimeter for the children as well as for the adults, and 4 centimeter for the infants. Okay. Minimal interruptions in compressions. That is very important. Complete chest recoil. That is also very important. Minimal compression. As I told, short time we have to give the maximum compressions, but we have to give time for the chest to recoil also. That is also important. Complete chest recoil. Okay. Effective breaths. Of course, as I told, you can feel the chest rise is there, then you can feel the effective breaths also. And do not hyperventilate. That is very important. We should not, if you hyperventilate, that will be not necessary as well, not beneficial for the patient also, isn't it?